All right, Justin, thank you so much. So joining us this morning to kind of help us better understand the president's diagnosis, we've got Dr. Stephen Smith, a vascular surgeon at Abrazo, Arizona Heart Hospital. Okay, so what exactly is it? Chronic venous insufficiency.
So this is a diagnosis where the veins in the lower extremities have become overwhelmed. Oh. And a variety of conditions can cause this. And one of the symptoms, I think, that spawned this investigation for the president was he had some lower extremity swelling.
Okay, so who is typically, more prone to get something like this?
Well, it's definitely more common as we get older. So
okay.
People that are over the age of about 70, people that are inactive, obese.
Yeah.
But the more important thing is that a lot of more serious chronic conditions can cause this swelling in the legs. And so, patients need to be evaluated for these conditions like heart failure, COPD,
yeah.
Pulmonary hypertension, sleep apnea, okay. Kidney failure, and a lot of other systemic diseases.
What does treatment look like with something like this?
Well, most of the time this condition is benign. So once these other more serious things are ruled out, yeah. then the typical treatment is really conservative. Weight loss, more activity, avoiding salt, wearing compression stockings. Those are usually the first sort of steps. And then there's treatments farther down the algorithm after these things have failed, where some minor procedures are often done on the legs.
Is there anything food-wise that you would ask someone to do if they have something like this that they could, take for themselves? Like, is it more water that you need, or is it different vegetables, or what?
Definitely hydration, good healthy diets. So there are some vitamins, like the B vitamins, I think have been shown to improve this. But mostly it's just, good healthy living, activity, lots of walking, exercise, controlling the weight.
A lot of people, when they see this, obviously the president going through this, having something like this, is it concerning? Is it something that people need to be concerned about?
My understanding for the statement that was released is they have ruled out these other conditions. So they've done an echocardiogram and ruled out heart failure, and they've ruled out chronic kidney insufficiency and these other sort of more serious things. So I think this is more of just a benign condition in his instance. Yeah.
Okay, so if you're treating the president and you've already ruled those things out, then what do you say to him? What are some things that he has to take into consideration every single day?
Well,
it's a pretty busy job.
He's a pretty active guy,
yes.
So I think it's not like more activity is probably his need, but I would put some compression stockings on him and just avoiding salt and trying to maybe work on the diet a little bit. That's the first steps, yeah.
Is there anything that this could lead to if it's not treated correctly?
Well, the later stages of chronic venous insufficiency can be serious. So they can actually lead all the way to patients that have ulcers near their ankles, dark stained skin and ulcerations, which are very difficult to heal. And that's a stage 6. Where he's at is really a stage 3, just a little bit of swelling.
And so, is it the swelling in the ankles that's really like the first thing that you can catch on to when it comes to this? Is that where you really see it?
Oftentimes patients have varicose veins,
yes.
But then when they lead into swelling...
I feel like you're talking to me because I feel like I went through all of this when I was pregnant.
Right, and pregnancy is definitely a risk factor.
Yeah, okay. Yeah. I don't think he has that.
No, I don't think so either. I don't think so either. But yeah, so varicose veins, and that's kind of like the early sort of stages. It's not actually even chronic venous insufficiency, but once you get into swelling, it becomes chronic venous insufficiency. And most patients don't progress to those later stages, but that's the kind of the worst end of the spectrum.
So really the takeaway here is, you treat it, but not really too concerning?
Not very serious.
Okay, there you have it. From the doctor himself, Dr. Smith, thank you so much for
Absolutely.
your time. Yep. Really appreciate it. All right, guys, back